Hi, welcome to Knowledge House. Today we're going to talk about something that often surprises people outside Korea: the National Health Insurance System. If you're from the US, this might sound unbelievable. Let's start with a simple fact: in Korea, everyone has health insurance. Yes, everyone. It's public, affordable, and it covers most medical costs. So how does it work? Every month, workers and employers contribute a portion of their income to the National Health Insurance Service. If you're self-employed or a freelancer, you pay a monthly premium based on your income and assets. This money goes into a shared pool that covers medical costs for everyone. When you go to the hospital, you don't pay the full bill. Instead, you pay about 20 to 30%, and the rest is covered by the insurance. That includes things like surgeries, checkups, childbirth, and even cancer treatments. Now let's compare this to the US. In America, there's no national health insurance for everyone. You might get coverage through your job, buy it privately, or have nothing at all. Even if you do have insurance, there's often a high deductible. That means you pay thousands of dollars out of pocket before insurance even kicks in. In Korea, the deductible is very low, and there's a cap on how much you'll pay per year. That way, even if you get really sick or have a long hospital stay, your out-of-pocket cost won't bankrupt you. Think about that. You can focus on healing instead of stressing about debt. And here's the best part: the Korean system doesn't just help with emergencies. It also covers preventive care like cancer screenings, vaccinations, dental checkups for kids, and health exams every 2 years for adults. That's how the country keeps overall healthcare costs down. Prevention is cheaper than treatment. In fact, Korea spends far less on healthcare than the US, but gets better results. According to OECD data, the US spends over $14,000 per person annually on healthcare. Korea? Less than half of that. And yet, life expectancy in Korea is higher. Now, is the Korean system perfect? Of course not. There are wait times, some advanced treatments aren't fully covered, and doctors may earn less than their counterparts in the US. But overall, people here don't avoid going to the hospital because of money. That's a huge deal. So next time you hear someone complain about paying a small health insurance premium in Korea, remember, it's protecting them from financial disaster. In Korea, getting sick doesn't mean going broke. But you might wonder, why doesn't the US have a system like this? There are several reasons. First, healthcare in America is heavily privatized. Insurance companies, pharmaceutical firms, and hospitals operate as profit-driven businesses. A national system would threaten their revenue models. Second, the U.S. political system is deeply divided. Proposals for universal health care often get blocked by partisan disagreements. Lobbyists for private insurers also have significant influence over legislation. And third, there's a cultural belief in personal responsibility. Some Americans see universal health care as government overreach, even if it benefits the public overall. It's a complex issue. But while the U.S. debates, other countries like Korea have already figured out how to make healthcare accessible and affordable for everyone. If you found this interesting, subscribe to Knowledge House for more real-world insights.